Hello, I'm going to be talking to you about health disparities and health inequities. We're going to be looking at major characteristics of the U.S. healthcare delivery system. As you can see by this graphic, the U.S. healthcare delivery system is very complex. There are a lot of different moving parts. And in some ways, it is missing a big group of people in the United States, and it's also complex for those who have insurance. So, one of the big things that we're going to look at this week is what are the health disparities and health inequities that are popping up when we take a look at the U.S. healthcare delivery system. The learning objectives for this week are know the basic concepts of the healthcare delivery system. I'm going to just talk a little bit about the finances and what are the challenges. I would like you to be familiar with the different healthcare systems that are in different countries. There's not one perfect system. However, the United States does not have universal health care. That means that not everyone has access to health care. In other countries, they do. So we're going to take a look at other countries and compare those countries. Maybe we could learn from those other countries and we could take some of those models and apply them to the U.S. healthcare system. We're going to know the difference between market justice versus social justice. Understand the basics with Affordable Care Act, and then we're going to look at solutions. So I want to begin by saying health disparities. An example of a health disparity is a difference between a group with a health outcome. In this case, for example, COVID-19 is affecting Black, Indigenous, Latinx, and other people of color the most. You look at the rate, 92 per 100,000. This means that Black or African American are getting COVID-19 at a higher rate than other groups. And comparably, you can see the Black or African American compared to white, Asian, other, or two more races. And so this is an example of a health disparity. Now you could look at other health disparities too, cancer, injuries, and different diseases. So with this one example, with COVID-19, this is a health disparity. What are the health inequities that could be causing this health disparities? How not having access to things that are support systems can actually create health inequity. So what are some of the things that might come to mind? Maybe did you think about health insurance? So whether you have health insurance or not, whether you can even get to the doctor, so transportation to the doctor. How about income? Whether someone can afford the deductible or the medicine that comes when you get access to the healthcare. So let's say you have a $5,000 deductible. Even though you have health insurance, you're not more likely to go, a person, right, in general, is not likely to go see a doctor if they're feeling ill, if they're worried about paying for it, worrying about how they're going to get there, and worrying whether they even can have the insurance or whether it will be covered. So when we look at wealth inequity, we can see that white non-Hispanic, what the income level is, and then when we see Black or African American non-Hispanic, you could see that the total net worth is different, 8 to 10 times greater than for Blacks and Latinos. So money also can influence healthcare and access to getting quality healthcare services or even just healthcare services. And so in the United States, when we think about Americans and healthcare, we know that there is a group, and this is I'm pulling this from a graphic, and I know that these numbers are constantly changing. And even right now, as I'm recording this video, we know that uninsured has probably gone up because when people become unemployed, because often people are employed and they get health care from their employer if they work a certain amount of hours. And if they become unemployed, they can become very much uninsured if they do not meet certain income criteria. Medicaid is income criteria. Medicare is for 65 plus and for people who meet certain health conditions. And this is other public funding. And then these are people who are getting health insurance who may not be getting it through their employer, but are getting it through different ways. So you could see that healthcare insurance in the United States is very complicated. It can be great for some people who are in the green, but it could be complicated for other people. Maybe a doctor doesn't accept Medicare or Medicaid. All right, so you can see that in the United States, it's definitely a moving target. So I pulled this up from the Commonwealth Fund, and this is an article that I'm going to ask you to read, is the United States Healthcare Overview. And you can see that in the United States, about 8.5, and this could be growing as we talk, we're a mixture of public and private. So public is Medicare, Medicaid, CHIP, military, or TRICARE, 34%. Private is insurance that people either pay for or they got it from their employers. Okay, so you could see that's how it's a combination of these. And then this group right here are uninsured. And this number is constantly changing as people are employed or as things change. It's like a moving target, like I was saying. So one of the things I'm going to ask you to do is to look at this tool called the HRSA Map. And I will show this link. And what I did was I checked medical underserved areas, and you could see areas where there are areas that do not have medical doctors or do not have access to health care. And so this HRSA map is a great tool. You can check these boxes and you can see where people are impacted with getting access to health care. And so with that, it brings me to this question: market justice versus social justice. The United States uses a market justice approach. So we use healthcare as an economic model. You can afford it. It's supply and demand. Case in point, when we had the outbreak of COVID-19, when it came to the mask and protection and healthcare devices to protect the healthcare providers, there was a bidding war on mask and PPE, and in general, that is showing an economic model. So it's like a supply and demand. It's free market position, so you can choose. It's market demand for services, so as a demand for a service goes up, the price for the service goes up. Also, for those making immunizations or coming up with medicines, there needs to be a high demand for someone to even go into the business of researching medicine or an immunization. So there needs to be a high demand for it in order for even the pharmaceutical company or the healthcare industry to develop those services. Do you see the supply demand? And services are provided on ability to pay. So if you're unable to pay, sometimes your ability to get that service is not possible. And it's access reward for personal effort. So the more you push to get access, the more you probably can get access to the service. In other words, you have to really be motivated. Social justice is the idea that healthcare is a social resource, that it requires government involvement. It assumes government in the lead position. It's the ability to pay is not necessary, and access is a right. So in the United States, we have gone with a market justice. Now, if you take my introduction to U.S. healthcare class, I'm going to tell you that I go into the history of why the United States is more market justice versus social justice. Now, we're not all or one, okay? We're a combination of these, but we definitely fall more into the market justice. There are some examples of where the government is involved, right? Can you think of someone like Medicaid, right? CHIP, TRICARE. You can see examples of that. But you could see examples of people definitely being left out, and it is not regulated across the United States. It takes healthcare policy. It takes laws changing in order for things to get regulated. You'll see cases of that, okay, where something has to get regulated. And I'm going to talk a little bit more about that. So the United States falls definitely on the market justice side. So the U.S. healthcare has a unique system of healthcare delivery. Most developed countries have something called universal access. That means that they have a system that will catch someone if, let's say, they get unemployed, right? They will have a healthcare system that they will immediately go into that will create a safety net. Or there's a national health insurance program that comes sweeping in. Each country has a different approach for that. However, this is not the case in the United States, where everyone is entitled. Everyone is not entitled to routine and basic health care services. So the government is a subsidiary to the private sector. So in other words, the private sector sets the rates, and then the government is kind of that safety net that comes in and acts as a safety net when it needs to. So in most developed countries, the government plays a central role in the provision of healthcare, so right up in the front. In the United States, the private sector plays a dominant role because of American tradition and desire to limit government. Now, this again is a whole nother lecture on the U.S. healthcare system history. And if you subscribe to my YouTube channel, I will go ahead and make that one public later. But I would definitely do a promo here to say, take the Introduction to U.S. Healthcare class. If you're not enrolled in that, make that one of your things that you do. That class is very common and is available in many colleges. And it definitely is something, and you can see some great videos on it out there too. But there's a history with the United States. And the reason why we're here today is because the private sector played the major role, and it started with it being tied to the employer and to contract and to agreements. It's one of those benefits that you know to negotiate with when you get a new job. And so, anyway, without going way into that, that's kind of a little history in a nutshell. Watch Sick Around the World. It provides a great overview. It's my front line. It's dated, but the same issues that were there in 2008 are here and are now, okay? And nothing has really changed, and it's still the same problems that we're still working through. And it gives you a synopsis of different countries, and I like how it does it. It really gets on the ground, so make sure you watch that. So I do have some good news. We have attempted to do healthcare reform throughout the history of the United States. Some of it has been successful, some of it is still in the works. And one of the big ones that we did was the Affordable Care Act, where we started, or some people call it Obamacare, where we started to expand Medicaid. And you will see that states that expanded Medicaid have greater access to health care. I'll make sure to put that link in the module so you can see that. So if someone expanded Medicaid and some states opted out of Affordable Care Act, and I have to tell you that if you take an economics class, the more people opt into something, the more it helps with the price of insurance. And so one of the things is that the healthcare reform did happen, right? And it took 41 million uninsured Americans in 2013 to 27 million uninsured Americans in 2016. And in the module, I'll have a link in my class module that will show you how that number changes based on how much we've expanded the Affordable Care Health Act. So increased coverage, improved access, and financial security, no cost coverage, preventative services for private health insurances, and There have been failed attempts to repeal ACA. However, there have been attempts to change it. So, for example, subsidiary actual contributions to lower the deductibles, that was changed. So some things have been changed with the Affordable Care Act. But one very popular one that's not showing up on this PowerPoint is the fact that people can stay on their parents' health care insurance up to a certain age. Oh, and the other one is that having a predisposing condition is used to be a way that people could be denied coverage, but that's not the case. Again, in my introduction to U.S. healthcare class, I go into this in detail a little bit more. So we have imperfect market conditions. For the healthcare market to be free, it needs to be unrestrained, competitive, and it needs to be based on the price and quality. But in a free market, patients as consumers must directly bear the cost of services, and they have to make decisions about the purchase of healthcare services. So because of this, the United States has seen an increase in our healthcare costs, and we are the most expensive healthcare system in the world. And I can also tell you that one of the other reasons is because technology, we adopt some technology, and whether that's effective or not, sometimes we pay for technology, and that will drive up our healthcare costs too. Also, the other thing is that we do not have transparent cost. So sometimes people will pay higher costs for one thing with one group or one employee, healthcare or hospital, to another. So like shopping around is something that you need to think about, and that healthcare is constantly driving up the prices. So this is what's happened. So with that though, we have health inequities, right? And so one of the big things is to improve those. And one of the things that the World Health Organization says is that in order to address this and the lack of healthcare access, we need to start thinking about improving daily living conditions. We need to tackle the inequitable distribution of power, money, and resources. And we need to measure and understand the problem and assess the impact of the action. And so that report is in your module. And there are success stories. Canada shows that by reducing health disparities, what they did is they started looking at healthcare needs and starting to make it more fair. They started to distribute. And because they did that, they were able to improve their health of the whole entire population. And so in there is in the Kaiser Family Foundation article, these are the things that they say will make a difference. And these are the strategies that need to be done to address health and healthcare disparities began nearly 2 decades ago. So it's been going on for 20 plus years. The Affordable Care Act did include provisions that advanced efforts to reduce disparities. At the federal level, the Department of Health and Human Services has engaged in a range of initiatives, and you will see now that people are constantly talking about health disparities where years ago they were not talking about it. So we are doing something that the World Health Organization suggested right here, measuring and understanding the problem, okay? So that is starting to happen. And at state, local communities, and private organizations and private providers are starting to really look at health disparities, and they're starting to look at the social factors. So I had a guest speaker, or I'm going to have guest speakers in our class, and before this unit. And so one of the big things is that you heard about that, and I would like you to think of some examples of how hospitals and healthcare organizations are looking at health disparities to really address this, and how you will see reports and things now actually showing and looking at resources and having that conversation, while years ago it was not being done. So in lecture, I discussed 2 examples, so I'm doing that right now. So the Kaiser Kaiser Permanente has done this. Central Oregon Health Council is doing this. And so think a little bit about some of the examples that I've provided prior to this lecture and how they're using that to make decisions. So that is something, it's a great article. So in conclusion, the United States has a unique system of healthcare delivery. It's comprehensive and continuous, but it's not enjoyed by everyone. It's a patchwork of subsystems. No country has a perfect system. There are health disparities caused by health inequities, but there are solutions. And one of the solutions is really looking at universal healthcare and looking at these solutions that are highlighted in the Kaiser Family Foundation article. So what I'd like to do now is I'd like to take you out to this some of the websites and that I would like you to read. First of all, I'd like you to look at this one's the International Healthcare Systems Profile. I really would like you to read through this because if you're not familiar with the U.S. healthcare system, this provides a great overview of public financing and private financing and how the systems work together. Do you see Medicare and Medicaid? So this is a good read. And then you're going to see a little bit about how things have changed and some of the safety nets have been put in place. Okay, so these are some of the things that the United States is doing to try to address this and try to address the U.S. healthcare system. And you'll see sometimes it's complicated. And if you go out, you can compare the different country profiles. But I would love for you really need to read through this entire United States system. It's really important. This is the tool that I was using before, where you can actually go in there and look at anything from opiates, healthcare centers, where we have shortage areas. And what this does is you just turn this on and you can start to see where there are disparities, where there needs to be more. And you could do this with a lot of different things. So have fun with this website. The one that I really liked looking at for this lecture was the medical underserved populations. And then I'm going to say no labels, and you can add it in, and it'll actually start to pop up. And then medically underserved areas, and you'll start to see it pop up. Do you see how that happens? It's pretty cool, huh? This is an example of Center for Disease Control and how they're starting to really look at health inequities by disease. If you look at the Center for Disease Control, you'll see this for other areas like cancer, mental health. It's not just for COVID-19. They're starting to do this with every disease, starting to look at who's impacted more. And then lastly, I will put this report in there and I'd like you to take a look at it. This is where you'll see the World Health Organization is coming up with suggestions and recommendations. So that is your material for this week and this lecture. And I look forward to seeing your reflections and your post for this week.